All right, well, thank you all for your patience. Thank you all for being here today. Evan, do you want to go through roll call and make sure we got everybody here?
Yeah, Trey Bennett,
Here?
Mayor Kaysen.
She said
He's
here.
here.
Yeah.
Clay Davis,
Here.
David Kidd. Here. Sheriff Sis.
He's muted. They've stepped away.
Dr. Rustin. Here. Mayor Reynolds.
Here.
Dr. Price. All members are present.
Okay. All right, well, with that, we'll call to order. I think the first order of business is approving the minutes from the last meeting.
I make a motion.
Motion,
I'll second.
second, all in favor?
Aye. Aye.
All opposed? Great, so approved. With that, I'll call on Taylor to introduce our recovery speaker.
All right. Thank you all for your patience. Sorry about that. But whatever, moving forward. So I am ecstatic to introduce our recovery speaker today. I truly don't know what he drinks in the morning that he has so much energy and is able to do so many different things. He came here from a CPS conference to do this talk and is on the phone talking about new programs that he's going to implement. I don't know how he does it. I feel that this person is someone who truly not only talks the talk, but walks the walk. He is a brilliant speaker, but I mean, if you follow him on LinkedIn or if you know him personally, you'll constantly see him throughout the community, helping people, engaging with people, doing grassroots activities. I truly don't know how he does it, where he gets his energy. I'm honored to know him and to introduce him today. So without further ado, Shane Sims will come give his recovery story.
Thank you.
Wherever you feel most comfortable.
Yeah, I don't,
Okay.
it's not showing the podium, but they'll
Okay.
be able to hear you,
Okay,
so.
okay, I just didn't want everyone having to turn around.
Yeah.
So, I'm under no small amount of pressure now that I'm a little late and I'm gonna hijack a few more minutes of your time this morning. So, let me begin by thanking, everyone on the GOSAC and everyone responsible for the abatement funds. I can tell you from a ground level that it is helping to restore lives, families, and communities, and I can't thank you enough. Again, my name is Shane Sims, and I'm a person in long-term recovery. Now, what that means to me is that it's been about 30 years since I felt the need to use any mood or mind-altering substances to escape both the real and perceived misery of my existence. Just as important as it's been,
I'll be glad to return your call. Thank you.
just as importantly, it's been about 7 years since my profession and my training as a certified addiction recovery empowerment specialist has taught me how to lead conversations, to lead events like this, not by highlighting all my accolades, but by talking about my struggles. And I began talking about my struggles, not to highlight the struggles themselves, but to highlight the human resilience that it took to overcome them. And it is said that we can connect in that space of commonality. And the commonality is that we as human beings have the resilience that it often takes struggles for us to tap into. Usually it's here that I will talk about the gifts of my recovery. Some of the wonderful things it's allowed me to do. The fact that I'm able to be a present father for my 4-year-old and able to be a pillar within my community. However, today I don't want to take time to talk about the destination, but instead I want to share a little bit with you about the process or the journey. So this is where I'm going to go back to that word, escape. Generally, when we hear the word escape, we're associated with positive outcomes. People that escape the lesser for the greater, the bad for the good. However, when it comes to the disease of addiction, it has a tendency to hijack this word. You see, for those of us that suffer from the disease of addiction, every youth promises an escape from something into something. But the brilliance of this disease is that it has the ability to promise you escape while consciously, observably, leading you deeper and deeper into captivity. And for many of us, particularly myself, that captivity is not just an emotional captivity, but it's also a physical captivity. During my senior year of high school, instead of going to West Georgia College to be a physical therapist as I had planned, my addiction, rather the things that drove my addiction, landed me in a very different destination. An Athens Clarke County judge would sentence me to life plus 15 years for accessory to felony murder and armed robbery. And no, I was not a robber. No, I was not a murderer. And that was the thing that led many of the people that knew me to say, well, what happened? Because both the incident and the process happened so quickly that it didn't give anyone time to properly process it. What happened that led me to that space where I began to associate with three guys and an older female who were all engaged in various forms of criminality? How did I go from being a prospect in high school, possibly going to change the world for people that may have hurt themselves in sports or needed the ability to get back well? How did I go from that to being inmate 359, 436, and what seemed to be a blink of an eye? Well, I tell you this, I think all of us in here have heard this saying. They say that hurt people, right? And I won't say that this is absolutely untrue. However, I say that what is more often true is that hurt people gravitate towards other hurt people. And the thing is that when you get hurt people associated with one another, the most important thing, the most pressing issue on their minds is to find a way to alleviate or eliminate that hurt. You see, this is a human thing. But some of us who are fortunate enough to be gifted with the tools to deal with hurt, or at least who are fortunate enough to recover from hurt inside healthy and supportive environments. Then there are those of us that did not have either. And when you don't have either, you don't just sit and hurt, you do something. You look around your environment, you grasp whatever you can to eliminate that hurt. Unfortunately, more often than not, that thing is drugs and alcohol. So I had one of my grandmothers, she asked me, she said, Shane, she said, I never understood, how did you end up associating with these guys? You were so different from them. You see, for myself, I was on a track to go to college. All of them had dropped out of school. I think the furthest one had made it was 7th grade. I had worked ever since the state of Georgia permitted me as a 13-year-old youth to get a job, and none of them had ever held a job. And she said, what did you guys have in common? Out of all of our dissimilarities, one thing that we did have in common was the use of marijuana and alcohol. More importantly, it was the pain that pushed us to use marijuana and alcohol. And the thing is, association breeds assimilation. The coping tools of our dominant environment, our dominant crowd will eventually become our coping tools. And I found myself making judgment and decision on the basis of my hurt, emulating what they had done to escape their own. And it didn't take long for the consequences to come raining down. Now, for those of you that are prudent enough to pay attention to say, well, if you were sentenced to life plus 15 years in prison, why in the heck and how the heck are you here now? Glad you asked. This is where we pivot to the journey of recovery. In recovery, there's a saying that goes, the opposite of addiction is not sobriety. The opposite of addiction is not doing drugs. The opposite of addiction is connection. And in order to understand this, you must understand what is the gateway to addiction. Most of us will probably say it's marijuana, it's alcohol. But the truth is that the gateway to addiction is not drugs themselves. These are symptoms or outcome. Rather, the gateway to addiction is more often than not trauma. And I think back to 1995 when I got into this, I can't help but to wonder if, had the judge that sentenced me known about the ACEs study that was initiated that year, had he known what Kaiser Permanente and CDC had concluded at the end of the ACEs study, and that was any child that experienced 3 or more adverse childhood experiences, meaning traumatic childhood experience, were more likely to, 1, engage in early promiscuity. My daughter was on the way into this world at age 13. 2, engage in the use of illicit drugs. I checked that box. 3, to develop addictions. I checked that box. 4, was more than likely to end up in the criminal justice system. I checked that box. And 5, when I learned this was the most devastating to me to think about what could have been the outcome. It said it's more up to 25% of their life expectancy is cut off. That's a child that's engaged or just experienced 3 or more unresolved childhood trauma experiences. My trauma was walking up with my parents doing the drug crack cocaine at the age of 12 years old. And in today's time, we may say, well, kids' parents do drugs all the time. We have to remember that this was the late 80s, early 90s. This was the crack cocaine epidemic. I'm going to call it an epidemic. It swept across this country. And I remember thinking that my mom and dad had to be Superman and Superwoman, because while my peers' parents or parents were all the victims to the drugs, we still had Christmases. We still had a stable household. And I began to realize that the kids were coming over to my house for dinner time, not because we were cool, but because they had nothing to eat in their own homes. So when I looked into the door of that room and saw my mom holding what I knew was a can used to smoke crack cocaine, my dad holding a lighter, I knew exactly what it implicated. And it devastated me. You see, to that point, I was a good kid. To that point, I had healthy coping tools. To that point, I felt safe in my environment. And things changed. So back to your question, if you were sentenced to life plus 15 years at 18 years old, we were only about 30 years ago. How did you get out? The opposite of addiction is connection. In addition to the religious background that my parents gave me, even in the midst of their addiction, I have to attribute it to this one man named Bilal Ramsey. He was an older resident. I'll call it inmate for the sake of recognizing what I'm talking about, at Telfair State Prison. I went there 18 years old, 145 pounds soaking wet in one of the worst prisons in Georgia. About as green as a pool table, twice as square. For whatever reason, Bilal took a notice of me. I would learn that he had been incarcerated at that time already 32 years. People didn't pay Bilal much attention because he had this strange tick in his neck. You know, in hindsight, it was probably T-Rex. But one day when I was getting ready to go outside with the rest of the people to escape my reality again, Bilal called me. He said, young man, he said, can I talk to you for a minute? And I said, yes, sir. Best decision I ever made. I spent the next year of my life going to Bilal's cell, sitting on that hard cement floor while he poured life into me. And one of the greatest things that Bilal gave me was one day he said, you know what? He said, there's something special about you. He said, you have a light inside of you. He said, when you get a certain age, that people are going to want to hold you, they're going to kiss you, they're going to want to be around you. And he told me that repeatedly enough until he tricked me to see that light within my own self. And for the first time in a long time, I began to see my value. So now let's talk about what are the outcomes. Eventually, I would develop a reputation in prison for designing programs for helping people, pouring to people that encouraged not one, not two, but 3 different prison wardens to petition the parole board for my release. And it was a third one with the most political pull, the most experience in prison, that told me straight up, he said, Shane, I'm going to get you out of prison. He said, when I get you out, if you mess up, I'm going to come kick your feet myself. And sure enough, he provided with a field officer of the parole board, and true to his word, I was released. I came home to my family February 3rd, 2016. Since then, I have become a chaplain for the Astor Clark County Police Department, where I have remained since 2016 now. I have a badge like an office badge. I have a key card that swipes in every police precinct in Astor Clark County. And the most significant thing about this is the restoration of trust. To this day, I am a chaplain for the Clark County Sheriff's Office. I direct a very successful nonprofit in Athens, Georgia, that has played a role in the restoration of lives and families all across the state. Today, I am the founder and the operator of a consultancy that travels all across this country to advocate for spaces for people to heal, spaces for people to return. And to this day, I'm a family man. I am someone that people can look at and say, hey, I don't see your past except in context of your presence. You give me the courage that if you overcame that, then I can too. So I leave you with this, is that I did not want to start out by introducing my accolades. They mean nothing without the context of what I had to overcome to get here. I say to you that the driver, the onset, the trigger, the entryway, the gateway for addiction is not marijuana, but rather it is a trauma. And I remind everyone in this room that addiction manifests itself in different ways. Some with opiates, some with marijuana, some with obsessive thinking, some with insecurities. But we must all address those traumas. We must all address those drivers. Otherwise, birds of feather will eventually flock together. But for those that are struggling with disease of addiction, know that recovery is not only possible, it's real, if only we connect to them. Thank you for your time. Thank you for your work.
Thank you so much for
Thank you.
being with us today.
Thank you, sir.
Holly, you wanna go through the update on recent activities?
Yeah, so I'd like to give just a quick update on, GOCAT activities in terms of how much we have expended in grant funds. So as of October 6th, 2025, the trust has reimbursed grant award recipients in the amount of $9,721,500.95. Also on on August 15th, 2025, the trust had to suspend one contract, and there is also one contract currently under audit. So, any questions?
All right. Evan distributed, I know they're a little off the presses, some draft bylaws that I wanted to put you all to consider. They largely just mirror the terms of the MOU. There's really two new things in there. One is I realized that I am y'all are a little held hostage by me, and that if I am sick or unexpectedly unavailable, this kind of y'all have to sit here and twiddle your thumbs. So the bylaws include a provision to allow someone else to chair a meeting in the case of my absence. I don't intend to be absent from any, but also wouldn't want everyone to show up and not have anything to do. And then the other one is Evan has been doing a great job serving kind of dutifully as our secretary and preparing everything. And so the bylaws kind of codify that position so that he's already been listed as such on the minutes, which is kind of reflecting that reality. But and then lastly, and I think kind of the most important one is to the extent that there ever is a conflict between the bylaws and the MOU controls regardless of what the bylaws say. So at the end of the day, we're following the MOU, but this is just kind of putting pen to paper and getting these out there and making sure that if I have a sick day, nobody else is wasting their time. With that being said, I know that y'all just got these a couple minutes before we started our meeting. If anybody wants to take the time to review them or welcome any edits, certainly welcome to push these to the next meeting. If y'all feel comfortable with them, we can go ahead and have a motion to adopt, but defer to the committee on when and how to address these.
Mr. Chairman, I'd like to make a motion that the commission adopt the bylaws. You've laid them out today, please.
Sir,
Second.
second, all in favor?
Aye.
Aye.
All opposed? All right, they are adopted. Thank you all. All right, and then I think our next item, Holly will go through the regional recommendations for GOSAC funding recommendations.
All right. So similar to last year, I'm going to read through each of the recommended applications. So you will be voting on.
Sorry, this is also in the bylaws and this has been existing practice, but if anybody has a personal conflict or conflict of interest with any of the funding recommendations, please recuse yourself. But I know that's kind of been the existing practice, but that's just reflected in there.
All right. Okay.
You got it.
Okay. You will be voting on recommendations made by regions 1 through 6. Regions 7 through 11, Cobb, DeKalb, Fulton, and Gwinnett counties in the city of Atlanta are qualified block grantees. They receive their funding allocation via the same mechanism as the other regions, but make their funding decisions independently. In total, the trust received 420 complete applications requesting more than $265 million. For each region, as well as the state applications, I will provide the recommended funding amount and a description of each regional application. So I'm going to start with Region 1. The trust received 65 complete applications requesting a total of more than $23.5 million in Region 1. The Regional Advisory Council is recommending funding 20 projects totaling $2,961,191.50 in year 1 and $1,575,004 in year 2 for a total of $4,546,195.50 over 2 years. Cherokee Focus is recommended for funding of $231,840 over 2 years in the prevention category. The funding will support the Drug-Free Cherokee and Healthy Pickens coalitions to deliver youth-focused prevention initiatives to reduce youth substance misuse in Cherokee and Pickens counties. Homestead Women's Recovery is recommended for funding of $85,500 for 1 year in the recovery category. The funding will support a 12-month transitional program that provides graduates of the residential recovery program with housing stipends, childcare assistance, vocational and education support, and mental health counseling. Recovery Bartow is recommended for funding of $236,700 over 2 years in the recovery category. The funding will support expanding peer-led recovery services in Gordon County, including staffing a full-time certified addiction recovery empowerment specialist, leasing an office for peer meetings and support services, and strengthening community partnerships. Newport Integrated Behavioral Healthcare is recommended for funding of $855,000 over 2 years in the recovery category. The funding will support the establishment of a dedicated addiction recovery support center in Douglas County, offering peer recovery coaching, support groups, life skills training, and linkage to behavioral health, housing, and employment services for adults and families. The Blake House is recommended for funding of $50,000 for 1 year in the treatment category. The funding will expand long-term residential recovery services for men in West Georgia by establishing a scholarship fund and purchasing a 15-passenger van to support transportation needs. Bridge Recovery is recommended for funding of $325,182.60 over 2 years in the recovery category. The funding will support the establishment of a recovery community organization in Lumpkin County, offering peer-led recovery coaching, student-focused programming in partnership with the University of North Georgia, community education system outreach, and community education and justice system outreach to expand access to recovery support and reduce opioid-related harms in rural North Georgia. The Pickens County Board of Commissioners, as the fiscal agent for the Appalachian Judicial Circuit, is recommended for funding of $409,685.40 over 2 years in the treatment category. The funding will support expanding medication-assisted treatment and outpatient services for accountability court participants across Pickens, Gilmer, and Fannin counties, including housing assistance, counseling, and dental care. Bridge Health is recommended for funding of $82,250.77 for 1 year in the treatment category. The funding will support Bridging the Gap to Recovery initiative, providing transportation assistance to individuals with opioid use disorder in Catoosa, Walker, Chattooga, and Dade counties, ensuring access to treatment, counseling, and medication-assisted recovery. The Children's Haven is recommended for funding of $45,000 over 2 years in the prevention category. The funding will support expanding opioid education and prevention efforts through in-home parenting programs, mentoring initiatives, and family visitation services in Cherokee County. WellRoot Family Services is recommended for funding of $313,646.65 over 2 years in the prevention category. The funding will support a multidisciplinary initiative that integrates legal services, social work, and peer support to address parental substance use, strengthen families, and reduce avoidable foster care placements through early prevention-focused interventions. The Walker County Sheriff's Office is recommended for funding of $378,000 for 1 year in the treatment category. The funding will support the launch of a comprehensive opioid recovery and reentry program at the Walker County Detention Center, providing evidence-based treatment, medication-assisted treatment, supported employment, temporary housing, and coordinated reentry services. Drug Awareness Incorporated, doing business as Jay's Place Recovery, is recommended for funding of $367,889.98 over 2 years in the recovery category. The funding will support the establishment of the Dawson County Peer Recovery Outreach Program, expanding peer-led recovery services to justice-involved individuals, parents in recovery, and other residents through individualized coaching, support groups, and system navigation assistance. Recovery Community Foundation of Forsyth is recommended for funding of $190,978.20 for 1 year in the recovery category. The funding will support the Jumpstart Initiative, providing early access to treatment, peer recovery coaching, case management, and aftercare for individuals with opioid use disorder across Region 1, while also expanding prevention, education, and outreach services through community workshops and recovery events. Mountain Lakes Medical Center is recommended for funding of $134,735.40 over 2 years in the prevention category. The funding will support continuation of the Life Care Specialist Program, which provides opioid misuse prevention, pain management education, behavioral health referrals, and chronic pain support services within the hospital's integrated clinical care model. Angel House of Georgia is recommended for funding of $151,200 over 2 years in the recovery category. The funding will support the Safe and Stable Housing for Women with Opioid Use Disorder Initiative, which provides licensed residential and transitional recovery housing, case management, and wraparound supports for justice-involved and high-risk women with opioid use disorder. Never Alone Clubhouse is recommended for funding of $357,687 for 1 year in the harm reduction category. The funding will support the Recovery to the Rescue Mobile Peer Recovery Initiative, which delivers harm reduction supplies, peer recovery support, and rapid access to treatment for individuals impacted by opioid use disorder throughout Douglas County. Dawson County Treatment Court is recommended for funding of $5,400 for 1 year in the treatment category. The funding will support the court's continued delivery of evidence-based treatment, case management, and peer recovery services to justice-involved individuals with opioid use disorder. Hall County Treatment Services is recommended for funding of $32,400 over 2 years in the treatment category. The funding will support the continued delivery of clinical treatment, case management, and peer recovery services for Hall County Drug Court and other accountability courts within the Northeastern Judicial Circuit. The Conasauga Drug Treatment Court is recommended for funding of $26,550 for 1 year in the recovery category. The funding will allow the court's in-house lab to purchase reagents to test for natural and synthetic opioids, supporting enhanced drug screening for participants in Whitfield and Murray counties. The Center for Wellness and Recovery of Northeast Georgia is recommended for funding of $256,549.50 for 1 year in the treatment category. The funding will support expansion of medication-assisted treatment and a substance abuse intensive outpatient program, along with transitional housing for men and women, workforce training, and harm reduction services in Stevens County and surrounding rural areas. These are all the Region 1 applications recommended for funding.
Is there any discussion on the Region 1 applications? We have a motion to. Do we have a motion to recommend the 65 applications with 20 recommended for funding for Region 1?
So moved.
Is there a second?
Second.
All in favor?
Aye.
Aye.
All opposed? Motion carries.
All right. Region 2. The trust received 47 complete applications requesting a total of more than $15.2 million in Region 2. The Regional Advisory Council is recommending funding 17 projects totaling $2,044,719 in year 1 and $559,756 in year 2 for a total of $2,604,486.52 over 2 years. The Genesis Center of Winder is recommended to receive funding for 2 projects. The first, for $109,500 for 1 year in the treatment category, will support comprehensive medication-assisted treatment for uninsured or financially disadvantaged individuals with opioid use disorder. The second, for $272,000 for 1 year in the recovery category, will establish Blackbird Place, a recovery residence for women in early recovery from substance use disorders in Winder. The program will provide safe housing, peer-led support, trauma-informed care, and employment readiness services in collaboration with Reboot Jackson. United Way of Central Georgia is recommended for funding of $450,000 over 2 years in the recovery category. The funding will support the Recovery Support and Transitional Housing with Wraparound Services initiative, providing substance-free housing, peer recovery, coaching, and comprehensive wraparound supports to help individuals experiencing homelessness and opioid use disorder. Tolliver County Family Connection Collaborative is recommended for funding of $97,350 for 1 year in the prevention category. The funding will support the Opioid Prevention and Mental Health Awareness Project, which will reduce opioid misuse and overdose by providing prevention, education, community engagement activities, naloxone distribution, and school-based mental health and substance use prevention programming across Tolliver County. The Augusta University Research Institute is recommended to receive funding for 2 projects. The first, for $37,338 for 1 year in the harm reduction category, will support a harm reduction initiative in partnership with Open Arms Outreach to install overdose response boxes containing Narcan and fentanyl test strips in Richmond County bars, nightclubs, and vape shops, along with staff training and digital education resources. The second, for $28,754, also for 1 year in the harm reduction category, will support installation of Narcan and fentanyl test strip boxes across the university's Richmond County campuses and embed overdose prevention education into student programming to increase awareness, promote harm reduction, and reduce overdose risk among college-age individuals. Walton and Powers is recommended for funding of $291,635 for 1 year in the recovery category. The funding will support the continuation and expansion of the Community Connections Peer Support Program at Piedmont Walton Hospital, embedding certified peer recovery coaches within the emergency department to provide immediate intervention, sustained follow-up care, and connections to treatment, housing, and community recovery resources for individuals experiencing opioid use disorder. Centenary Community Ministries is recommended for funding of $159,140 for 1 year in the recovery category. The funding will support the Centenary Community Ministries Transitional House, which provides long-term structured residential recovery and wraparound services for adult men with opioid use disorder, including stabilization, vocational training, and step-down support toward independent living. Screven County Community Collaborative is recommended for funding of $76,000 for 1 year in the prevention. The funding will support the United for Opioid Education Project, a comprehensive community-based initiative focused on opioid prevention, education, and intervention through school partnerships, public awareness campaigns, naloxone distribution, and youth mental health programs to reduce stigma and prevent substance misuse. Merrick Healthcare is recommended for funding of $127,912 over 2 years in the treatment category. The funding will expand medication-assisted treatment with methadone and/or buprenorphine paired with counseling, peer support, and overdose prevention education for underserved residents in Bibb County. Jefferson County Community Ships for Youth is recommended for funding of $105,400 over 2 years in the treatment category. The funding will continue diversion services for justice-involved adults and expand to include at-risk youth ages 11 to 17. The program will provide counseling, case management, relapse prevention, and restorative justice services to reduce recidivism, strengthen families, and address substance use and opioid-related challenges across Jefferson County. Project Adam Community Assistance Center is recommended for funding of $76,638.48 for 1 year in the treatment project category. The funding will expand Project Adam's intensive outpatient therapy and treatment program for youth ages 13 to 18, providing trauma-informed, opioid-focused, and anger management therapy for individual and Betty,
I'm not sure. I think they have us all muted right now.
There we go. Let's see, Project Adam, I was in the middle of Project Adam. The funding will expand Project Adam's intensive outpatient therapy and treatment program for youth ages 13 to 18, providing trauma-informed, opioid-focused, and anger management therapy through individual and group sessions, assessments, and aftercare services, particularly supporting adolescents and families affected by the Appalachia High School tragedy. Piedmont Athens Regional Foundation is recommended for funding of $13,897 for 1 year in the harm reduction category. The funding will expand access to naloxone for high-risk patients discharged from its emergency department. The initiative will provide free naloxone and education materials and ensuring that residents across Athens, Clark County, and 17 surrounding Northeast Georgia counties have life-saving tools to prevent opioid overdose deaths. New Start Treatment Milledgeville is recommended for funding of $153,300 over 2 years in the treatment category. The funding will expand access to medications for opioid use disorder in Region 2, providing treatment to indigent patients. This initiative was developed in partnership with the Oconee Recovery Coalition and the Georgia Council for Recovery. Sojourn Ministries, doing business as Navigate Recovery Barrow, is recommended for funding of $298,900 over 2 years in the recovery category. The funding will establish the Barrow County Addiction Recovery and Wellness Center. The project will integrate peer support, wellness services, and evidence-based recovery practices to reduce relapse, overdose, and disengagement from care among adults with substance use and co-occurring disorders through trauma-informed, community-based interventions. Metro Treatment of Georgia is recommended for funding of $76,650 for 1 year in the treatment category. The funding will support the center's initiative to provide treatment scholarships covering 6 months of comprehensive medication-assisted treatment for individuals with opioid use disorders who face financial barriers. Divergent Recovery Center for Men is recommended for funding of $230,060.52 for 1 year in the recovery category. The funding will strengthen recovery and reintegration services for men in early recovery from opioid addiction in Clark County and neighboring areas. The project will provide trauma-informed housing, counseling, job readiness training, and long-term peer recovery support to reduce relapse, improve stability, and promote sustained community integration. These are all the Region 2 applications recommended for funding.
Is there any discussion on the Region 2 recommendations? Is there a motion to recommend the?
I make a motion to approve.
Is there a second?
Second.
All in favor?
Aye.
All opposed?
Aye.
Motion is approved.
The trust received 11 complete applications requesting a total of more than $3.9 million in Region 3. The Regional Advisory Council is recommending funding 5 projects totaling $505,834 in year 1 and $421,122 in year 2 for a total of $926,956 over 2 years. Gwinnett County Board of Health, doing business as GNR Public Health, is recommended for funding of $115,200 over 2 years in the harm reduction category. The Naloxone Access Initiative will place stocked vending machines in the Rockdale County Jail and Piedmont Rockdale Hospital and distribute naloxone through the health department, pairing tokens and education to reach high-risk individuals and families. Newton Community Partnership is recommended for funding of $182,545 for 1 year in the prevention category. The funding will support expansion of the Newton County Drug-Free Community Coalition's education and awareness campaign to prevent youth opioid misuse through school-based and community-focused outreach initiatives. Pillars Initiative is recommended for funding of $208,000 over 2 years in the prevention category. The funding will support the launch of the Prevention Studio, a youth-led creative lab that produces peer-informed prevention media and campaigns to reduce opioid misuse and promote resilience across Clayton County and surrounding Region 3 communities. The City of Morrow is recommended for funding of $6,000 for 1 year in the prevention category. The funding will support the Drug Disposal Project, which expands access to safe medication drop boxes and public education efforts throughout Morrow and surrounding Clayton County communities. Positive Impact Health Centers is recommended for funding of $415,211 over 2 years in the recovery category. The funding will support the expansion of integrated recovery and harm reduction services in Clayton County, including in medication-assisted treatment, peer support, mental health counseling, and HIV hepatitis prevention initiatives. These are all the Region 3 applications recommended for funding.
Any discussion on the Region 3 recommendations? Motion to approve? Second? All in favor?
Aye.
Opposed? Motion carries.
The trust received 15 complete applications requesting a total of more than $4.9 million in Region 4. The Regional Advisory Council is recommending funding 2 projects totaling $548,874.38 in year 1 and $150,000 in year 2 for a total of $698,874.38 over 2 years. Georgia Pines Community Service Board is recommended for funding of $398,874.38 for 1 year in the harm reduction category. The funding will establish the Georgia Pines Hope Van Program, a mobile harm reduction and outreach initiative that delivers naloxone distribution, safe syringe services, and behavioral health screenings to unhoused and high-risk individuals in Thomas County. South Georgia Stars Academy is recommended for funding of $300,000 over 2 years in the prevention category. Funding will support a comprehensive evidence-based opioid prevention and awareness initiative across 5 Southwest Georgia counties, implementing prevention plus wellness curricula, parent engagement, youth empowerment programs, and a public education campaign. These are all the Region 4 applications recommended for funding.
Any discussion on the Region 4 recommendations? Motion to approve.
So moved.
Second.
Second.
All in favor?
Aye.
Aye.
All opposed? Motion passes.
The trust received 38 complete applications requesting a total of more than $17 million in Region 5. The Regional Advisory Council is recommending funding 12 projects totaling $1,512,743.42 in year 1 and $798,735.22 in year 2 for a total of $2,311,478.64 over 2 years. New Roots Glen is recommended for funding of $164,232 over 2 years in the recovery category. The funding will launch the SET or SET or Sustain, Expand Transport Initiative to provide transportation employment readiness programs and wellness training in collaboration with local partners, helping individuals in early recovery sustain long-term stability and independence. Georgia Southern University Research and Service Foundation is recommended for funding of $234,474 over 2 years in the prevention category. The funding will expand the university's naloxone initiative and overdose prevention services across its Statesboro, Savannah, and Hinesville campuses, enhancing access to naloxone, distributing fentanyl test strips, and delivering evidence-informed education to students, faculty, and staff. The Atlantic Judicial Circuit Accountability Courts are recommended for funding of $101,905 for 1 year in the treatment category. The funding will expand access to medication-assisted treatment across the circuit's 4 accountability courts by adding addiction medicine oversight, offering 4 medications at no cost, integrating dialectical behavioral therapy and yoga as adjunct therapies, and improving recovery outcomes for participants with opioid use disorder. Georgia Prevention Project is recommended for funding of $201,416 for 1 year in the prevention category. The funding will expand a school-based opioid prevention initiative into Appling and Jeff Davis counties, providing K-12 students and school personnel with comprehensive prevention education, peer-led campaigns, and community engagement activities in partnership with the Carter Center. The Coastal Health District is recommended for funding of $305,158.51 over 2 years in the prevention category. The funding will support a comprehensive opioid initiative to assess community needs, expand outreach and education, develop an opioid data dashboard, and increase public access to harm reduction tools, including naloxone, fentanyl test strips, and drug disposal pouches. The Community Service Board of Middle Georgia is recommended for funding of $605,837.90 over 2 years in the recovery category. The Region 5 Opioid Treatment and Recovery Initiative will establish a new Step 1 recovery center in Mount Vernon and expand the Rise Up Addiction Recovery Support Center to provide evidence-based treatment, telehealth, and peer-led recovery services that increase access to care and support sustained recovery across rural communities in Region 5. Grace House of Brunswick is recommended for funding of $71,723.24 over 2 years in the recovery category. The project will expand recovery support by providing trauma-informed therapy, including cognitive behavioral therapy, eye movement desensitization and reprocessing, known as EMDR, and holistic approaches such as internal family systems and somatic experiencing while enhancing family facility spaces for privacy and accessibility of in-person and online sessions. Share Health Southeast Georgia is recommended for funding of $258,024.04 over 2 years in the prevention category. The project is intended to strengthen local community coalitions and expand youth-focused prevention and overdose risk education efforts by providing technical assistance, training, and community engagement initiatives. Clinch Memorial Hospital is recommended to receive funding for 4 projects. The first for $338,207.95 for 1 year in the treatment category will expand access to evidence-based medication-assisted treatment and substance abuse intensive outpatient program services to improve treatment availability, continuity of care, and recovery outcomes for individuals impacted by opioid use disorder in Clinch County and surrounding rural areas. The second, for $9,500 for 1 year in the harm reduction category, will expand naloxone access across South Georgia through community distribution, mobile harm reduction outreach, overdose prevention education, and digital resources to improve awareness and emergency preparedness. The third, for $8,500 for 1 year in the prevention category, will expand community education and outreach through youth-focused seminars, family support programming, digital resource development, and quarterly events aimed at reducing overdose risks and increasing public awareness. And the fourth, for $12,500 for 1 year in the training category, will expand overdose prevention training across South Georgia by providing education to students, first responders, and community members, launching a Train the Trainer program and developing an online training platform to increase naloxone awareness and access. These are the Region 5 applications recommended for funding.
Any discussion? Motion to approve. Second. All in favor?
Aye.
All opposed? It's approved.
This is Betty Cason. I'll have to recuse myself on Region 6.
Okay. On all of Region 6 or a specific one?
University of West Georgia.
Okay. We will just take that one up separately then.
All right, thank you.
Do you want me to read University of West Georgia 1 separately? Or do you want me to go ahead?
I'd say just go through them and then we'll just do 2 at the end.
Region 6 received 42 complete applications requesting a total of more than $16 million. The Regional Advisory Council is recommending funding 9 projects totaling $1,869,568.16 in year 1 and $823,131.66 in year 2 for a total of $202,692,699.82 over 2 years. New Avenue Life Outreach is recommended for funding of $310,630 for 1 year in the recovery category. The project will establish an addiction recovery support center in Spalding County to expand peer-led recovery services, harm reduction education, and community-based supports. The University of West Georgia is recommended for funding of $164,206.50 over 2 years in the recovery category. The Wolves Rise Collegiate Recovery Program will provide peer-led recovery support, harm reduction training, and educational programming to reduce opioid misuse, promote student wellness, and foster a culture of recovery and resilience across the UWG campus community. Nick's New Beginnings is recommended to receive funding for 2 projects. The first, for $427,532.50 over 2 years in the recovery category, will expand the Addiction Recovery Support Center in Butts County to provide peer-led recovery coaching, resource navigation, naloxone distribution, and partnership with hospitals, community organizations, and correctional institutions. The second, for $22,700 over 2 years in the recovery category, will expand peer-led recovery support programs in Butts County by sustaining gender-specific recovery meetings, launching youth-focused programs, and hosting quarterly women's sober social events, offering childcare, meals, and outreach efforts. Midway Recovery Systems is recommended for funding of $231,760 for 1 year in the treatment category. The project will expand access to long-term residential recovery services for adult men across Region 6 by funding treatment scholarships, transportation, and additional certified staff. Coweta Force is recommended for funding of $736,462.82 over 2 years in the recovery category. The funding will support the Parent Elected Peer Advocate Program, or PEPA, which provides peer-led recovery support, case plan assistance, and family reunification services for individuals with opioid or substance use disorders involved with DFACs in Coweta and Troup counties. Twin Cedars Youth and Family Services is recommended for funding of $307,402 over 2 years in the recovery category. The project will expand Safe Families for Children programming in Troup and Muskogee counties, providing wraparound prevention and recovery supports for families with opioid addiction through volunteer-driven childcare, transportation, and family stabilization services. Hope Incorporated is recommended for funding of $98,318 for 1 year in the training category. The Community Opioid Response and Education, or CORE initiative, will provide peer-led training, naloxone distribution, and stakeholder engagement in Peach and Houston counties to equip first responders, educators, and community leaders with the knowledge and tools to prevent overdoses and promote recovery. New Start Treatment is recommended for funding of $393,688 for 1 year in the treatment category. The project will expand access to medication-assisted treatment in Spalding County by funding a patient scholarship program for uninsured individuals and hiring dedicated outreach and support staff. These are all the Region 6 applications recommended for funding.
Yes, there are two of them. Okay, I'm chairman of Spalding County.
Yes, sir.
I have 3 of those that are in my county, not directly related to what I do as a chairman of the Spalding County Board of Commissioners. And then one of them, Butts County, which is in my CSB area when I put my hat on as the chairman of the CSB. However you want to do it, none of them do I fund to do stuff with through my business and do I vote on. But they're all, 3 of them are in my county doing good stuff for us.
But you don't have any non-official interaction with them. So usually,
I have no official action with the 3 in Spalding County or Butts County, other than I'm the chairman for both of those counties of the CSB.
do you feel that you can vote on them neutrally and unbiasedly?
I do.
Then I don't believe there's any conflict.
I do.
Well, Mayor Kaysen has indicated that she wishes to recuse herself from the University of West Georgia's application. So we will do, well, I guess barring any discussion, we will do 2 motions. One for the recommendations from Region 6, except for item 1323, which is University of West Georgia's application. And then we'll do a motion on 1323 separately.
Okay, the first motion, the big
So
group.
that's a motion for the Region 6 recommendations, except for item 1323.
Correct.
Is there a second?
Second.
All in favor?
Aye.
All opposed? All right, that one carries. And then specific to item 1323, which is University of West Georgia's application that Mayor Kaysen has recused herself from. A motion to approve that item.
So move. Second.
Second, all in favor?
Aye.
Opposed? That also carries. And then Holly, you've been having a marathon session. So before we get into the state applications and ask you to go for like 20 minutes straight, do anybody like to take a recess before we move into the state applications or power through?
I can power through. It's just, she has been reading and reading and reading. And
I'm kind of getting into like, it gets a little meditative at some point, so.
so I'll go with whatever Holly says. If she wants to go, I'll
Ready to
go.
go?
All right, well, we will move into the state applications then. Holly, are we gonna do these as a block as well, or are we gonna do one by one?
No, block.
Okay. All right, well, that concludes the regional applications and these are the state
All
applications.
right, here goes. The press received 202 complete applications for statewide projects requesting a total of more than $184.7 million. Recommended for funding are 46 applications. totaling $17,969,633.23 in the first year, $10,945,017.88 in the second year, for a total of $28,914,651.11 over 2 years. Grady Health System is recommended to receive funding for 2 projects. The first, for $473,326.35 over 2 years in the prevention category, will expand Grady's Life Care Specialist Program by adding two full-time specialists and 1 coordinator to provide patient-centered education, pain management support, and opioid misuse prevention, while serving as Georgia's statewide life care specialist training hub to strengthen holistic and evidence-based pain care across multiple clinical departments. The second, for $573,510 over 2 years in the recovery category, will sustain and expand Grady's hospital-based peer recovery coach program by adding a 4th full-time coach to improve emergency and inpatient support for individuals with opioid use disorder. Fayette Factor is recommended for funding of $470,000 over 2 years in the prevention category. The organization will launch the Georgia Multi-Faith Opioid Prevention and Education Campaign, a statewide initiative providing culturally tailored harm reduction education, naloxone training, and stigma-free messaging through Christian, Muslim, and Jewish faith leaders to expand prevention, awareness, and recovery support across all 6 regions. The extension is recommended for funding of $616,698.32 over 2 years in the treatment category. The funding will allow the extension to expand its long-term residential treatment capacity by adding new beds for adults with opioid use disorder and hiring additional counseling and case management staff to strengthen recovery services for individuals experiencing homelessness and substance use disorders. Sojourn Ministries, doing business as Lightway Recovery Wellness, is recommended for funding of $495,000 over 2 years in the treatment category. The funding will expand Lightway's long-term peer-led residential recovery program for women, including expectant and postpartum mothers, by increasing scholarships for uninsured patients and enhancing services focused on family reunification, employment readiness, and long-term recovery stability. Consecrated Care is recommended for funding of $393,688 for 1 year in the treatment category. The funding will support the Project CARE Recovery Access and Engagement Support Initiative, which provides financial scholarships for low-income and uninsured patients and funds new staff positions to enhance outreach, patient recruitment, and community partnerships to expand access to medication for opioid use disorder in Clayton County and the surrounding Metro Atlanta region. Georgia Parent Support Network is recommended for funding of $10,000 for 1 year in the prevention category. The Navigating Hope initiative will deliver culturally responsive education, social media outreach, and peer-informed messaging to youth, families, and underserved communities statewide. DM and ADR is recommended for funding of $281,510 for 1 year in the treatment category. The funding will support expansion of medication-assisted treatment services by establishing community outreach to underserved populations, creating direct referral pathways for no-cost healthcare and wraparound services, launching a community MAT support group, and providing transportation and treatment scholarships to improve access and retention in care for low-income and uninsured individuals. Dynamic Care Health is recommended for funding of $873,575.66 over 2 years in the treatment category. The funding will support the launch of a 2-year digital contingency management initiative serving 250 Georgians with opioid use disorder, using a mobile app to deliver behavioral incentives, remote substance testing, telehealth coaching, and cognitive behavioral therapy modules to improve treatment retention, reduce relapse, and strengthen long-term recovery outcomes across regions 1, 2, and 6. Coweta Force is recommended for funding of $156,700 for 1 year in the recovery category. The funding will support a full-time program manager, vehicle, and driver to enhance operations at the Birch Recovery Residence, expanding trauma-informed, peer-led recovery housing and transportation services for women in recovery to promote stability, accountability, and long-term independence. Health West Frontiers is recommended for funding of $396,552.48 over 2 years in the treatment category. The funding will support a multi-site initiative to expand medication-assisted treatment through transportation assistance, tiered financial support for methadone and buprenorphine costs, and a prevention prevention education campaign across 7 locations, targeting high-need populations such as justice-involved individuals, pregnant women, and low-income adults. Mary Hall Freedom Village is recommended for funding of $2,851,153.85 over 2 years in the recovery category. The funding will expand recovery housing and services by adding beds and providing peer support, trauma-informed care for pregnant parenting women, harm reduction, and employment readiness programs. Athens Wellness Clinic is recommended for funding of $470,846 over 2 years in the harm reduction category. The project will expand harm reduction and infectious disease services by installing a naloxone vending machine, reinstating staff, funding hepatitis C testing and treatment, and launching a mobile outreach unit to provide resources to uninsured individuals. Imagine Hope is recommended for funding of $221,000 over 2 years in the harm reduction category. The project will expand hepatitis C and HIV screening and treatment access by training rural charitable care clinics, supporting diagnostic testing for uninsured behavioral health clients, and creating educational materials to increase awareness and linkage to care statewide. Odyssey Atlanta is recommended for funding of $394,875 for 1 year in the prevention category. Through its Smart Choices for Life initiative, Odyssey will provide evidence-based, family-centered opioid and substance use prevention education to students and caregivers across 7 counties, combining school-based workshops, caregiver engagement sessions, and behavioral health partnerships. Community Education Group is recommended for funding of $691,807.20 over 2 years in the training category. The project will expand medication-assisted treatment, education, and awareness training for healthcare providers, first responders, and community members in rural Georgia, integrating infectious disease prevention and the CHAMPS Community Health Worker Program, not the CHAMPS program run by the Georgia Sheriff's Association. Gwinnett United in Drug Education, known as GUIDE, is recommended for funding of $842,566 over 2 years in the prevention category. The organization will implement the Opioid Youth Action Team Network, known as the OPI or OP Network, to expand its youth-led, adult-supported prevention model across all 6 regions, training youth action teams to plan and deliver opioid and substance use prevention strategies. The Institute for Health Logistics and Analytics at Georgia Southern University is recommended for funding of $872,566.96 over 2 years in the training category. The project will transform rural public libraries into opioid harm reduction hubs by training library staff as lay health navigators, installing naloxone access and digital resource kiosks, and developing a statewide rural opioid harm reduction library toolkit to expand stigma-free reduction, education, and recovery support across rural communities. Mercer University is recommended for funding of $398,078 over 2 years in the treatment category. The funding will support the implementation of Mom Care, an evidence-based mobile health platform developed with GOMO Health to deliver personalized digital support, education, and care coordination for pregnant and postpartum women with opioid use disorder across Liberty, Chatham, and Fulton counties. Advantage Behavioral Health Systems is recommended for funding of $1,114,429.50 over 2 years in the treatment category. The funding will support the expansion of the Men's Refresh Transitional Housing Program, a trauma-informed, peer-led residential initiative for adult men recovering from opioid use disorder. The Georgia Council for Recovery is recommended for funding of $199,067.24 for 1 year in the recovery category. The Recovery Coach Virtual Connections Initiative will expand peer recovery support in rural Georgia through a full-time certified peer specialist providing virtual real-time engagement for individuals with opioid use disorder. The Sobriety Resource is recommended for funding of $490,000 over 2 years in the recovery category. The funding will provide financial scholarships for individuals seeking long-term residential treatment or sober living, assist families in navigating care options, and expand recovery support such as transportation, basic needs, and educational programs. Motherhood Beyond Bars is recommended for funding of $220,000 over 2 years in the research and evaluation category. The funding will support the development of an evaluation framework and data systems for Georgia's maternal incarceration and opioid reduction initiative, enabling the organization to strengthen implementation, assess outcomes, and generate national best practices for maternal diversion and family-centered recovery programs. Forensic Medicine Associates is recommended for funding of $79,980 over 2 years in the research and evaluation category. The funding will support comprehensive forensic toxicology testing for opioid-related deaths in Hall, Henry, and Rockdale counties, improving overdose mortality data accuracy, and enhancing statewide surveillance of opioids and emerging synthetic substances to inform public health policy and prevention efforts. Southern Healthcare Collaboration is recommended for funding of $1,498,570 over 2 years in the treatment category. The funding will expand opioid treatment and recovery housing services across Emmanuel, Appling, and Bacon counties by increasing access to medication for opioid use disorder, transportation, and transitional housing for justice-involved and low-income individuals, and strengthening local workforce capacity through training and Narcan distribution. Kennesaw State University is recommended for funding of $654,424 over 2 years in the prevention category. In partnership with Mercer University, the program will implement a statewide maternal opioid response model that trains doulas, community health workers, and perinatal providers to prevent opioid misuse among pregnant and postpartum individuals, reduce neonatal abstinence syndrome, and expand equitable stigma-free care coordination across Georgia's rural health districts. Midway Recovery Systems is recommended for funding of $156,403.60 over 2 years in the treatment category. The funding will establish the Midway Mom Project in Griffin, a residential recovery program for pregnant and parenting women with substance use disorders, offering trauma-informed treatment, maternal health monitoring, parenting support, and safe housing to promote family reunification. HopeQuest is recommended for funding of $35,000 over 2 years in the training category. The project will engage churches and faith-based organizations across Georgia through bi-monthly events, listening sessions, and community conversations to educate faith leaders, build local recovery networks, and strengthen community-based responses to the opioid crisis using the SAMHSA Strategic Prevention Framework. Project Adam Community Assistance Center is recommended for funding of $173,150 for 1 year in the recovery category. The funding will expand recovery support services at its licensed residential facility by adding employment and life skills coaching, transportation assistance as residential scholarships for uninsured or indigent men with opioid use disorder. Pathlight Counseling is recommended for funding of $428,600 over 2 years in the treatment category. Funding will expand evidence-based outpatient and medication-assisted treatment programs tailored for veterans and first responders in Cherokee, Forsyth, and Fulton counties, incorporating peer support, EMDR therapy, neurofeedback, and family engagement. The Georgia Department of Public Health is recommended for funding of $452,875 over 2 years in the harm reduction category. The project will expand statewide naloxone distribution, improving efficiency, access, and tracking to ensure timely delivery to community-based organizations, public health districts, and high-need populations across the state. Hope House is recommended for funding of $788,164.93 over 2 years in the treatment category. The funding will expand the Rural Roots to Recovery program to provide comprehensive, trauma-informed, family-centered residential and outpatient treatment for pregnant and postpartum women with opioid use disorder in rural Georgia, offering medication-assisted treatment, childcare, housing support, and case management. Men and Women for Human Excellence is recommended for funding of $976,780 for 1 year in the treatment category. Funding will support the expansion of outpatient and medication-assisted treatment programs and the addition of transitional housing beds for homeless women with opioid use disorder, providing trauma-informed, evidence-based, and culturally responsive care that integrates treatment, recovery support, and housing. Gateway Community Service Board is recommended for funding of $1,068,000 over 2 years in the training category. The project will sustain and expand Gateway's Addiction Medicine Fellowship in partnership with Mercer University, training new physicians to provide evidence-based opioid use disorder treatment, prevention, and jail entry services across 8 counties, while strengthening MAT access, relapse prevention, and harm reduction initiatives for underserved communities. The Georgia Primary Care Association is recommended for funding of $1,847,271.82 over 2 years in the treatment category. The funding will expand access to medication assisted treatment for uninsured and underserved individuals through 10 federally qualified health centers supporting integrated behavioral health and primary care teams, standardized screening and bundled payment systems to improve opioid use disorder treatment, continuity care, and recovery outcomes statewide. Viewpoint Health is recommended for funding of $1,452,700 for 1 year in the treatment category. The funding will sustain the operation of its standalone detox center in Newton County, ensuring continued statewide access to detox services for individuals experiencing substance use crises, particularly uninsured, underinsured, and low-income Georgians. Mercer University School of Medicine is recommended for funding of $276,269.70 over 2 years in the research and evaluation category. Funding will support scientific research to better understand how a specific part of the brain contributes to the motivation to take fentanyl, as well as research into identifying the psychological and biological indicators that may increase the risk of a fentanyl overdose. Divergent Recovery Center is recommended to receive funding for 2 projects. The first, for $368,400 for 1 year in the recovery category, will support the expansion of residential recovery services for women with opioid use disorder by enhancing peer mentorship, licensed counseling, medication-assisted treatment, and vocational training, while strengthening partnerships with community and behavioral health organizations. The second, for $355,200, also for 1 year in the recovery category, will support a 12-month recovery home program for women, providing case management, therapy, financial education, and transitional housing assistance to help individuals rebuild stability, repair credit, secure employment, and sustain long-term recovery following treatment for opioid use disorder. Claritel Behavioral Health is recommended for funding of $1,209,569.85 for 1 year in the treatment category. The funding will enhance Claritel's residential substance use disorder program by adding beds for adult men with opioid use disorder, particularly those who are unhoused or justice involved, and by expanding outreach efforts that provide community overdose prevention, education, and linkages to treatment and recovery resources. CMG Media Group is recommended for funding of $573,222 for 1 year in the prevention category. This project will include public service announcements on news, daytime, primetime, sports, and late-night programs on WSB TV, as well as the production and hosting of 1-hour primetime TV special to raise awareness about opioid misuse, reduce stigma, prevent harm reduction practices, and highlight success stories from the Trust initiatives. Lexicon Strategies is recommended for funding of $158,500 over 2 years in the prevention category. The funding will support a journalist training program on opioid coverage, including media monitoring for training impact, as well as a statewide foster family pilot program to train foster families on at-home opioid deactivation kits. The Georgia Association of Broadcasters is recommended for funding of $269,000 for 1 year in the prevention category. Through a statewide public education program, the association will execute a multimedia opioid awareness campaign using 30-second public service announcements on radio and television across the state to educate residents, reduce stigma, and promote prevention and treatment resources for at-risk populations. The Georgia Department of Community Supervision is recommended for funding of $167,273.94 for 1 year in the treatment category. Funding will expand substance use treatment, drug testing, and transitional housing for justice-involved individuals with opioid use disorder by enhancing day reporting center services, increasing drug screenings, and providing Narcan. Emory University is recommended for funding of $509,764.50 over 2 years in the training category. The project will expand Emory's medical toxicology fellowship by funding 2 additional fellows to increase the addiction medicine workforce, serving medically underserved populations, strengthen clinical services at Grady Memorial Hospital, and train future providers to deliver evidence-based care for individuals with opioid use disorder statewide. CareLink of Georgia is recommended for funding of $1,908,581.22 over 2 years in the treatment category. The funding will expand CareLink's statewide medication for opioid use disorder program, increasing access for indigent patients by contracting with SAMHSA licensed opioid treatment providers to deliver evidence-based methadone treatment and related support services across all regions. These are all the state applications for
Great.
Take a nap now.
Not yet.
I need to recuse myself from the Department of Public Health's application.
Chris, how far down does that go? I'm a Board of Health at a county level, a vice chair there. Is that should I recuse?
1250 is I believe, the number for the Department of Public Health. But here on the Board of Health,
You're the vice chair.
well, the boards of health are separate entities from DPH, so I'd leave that up to legal to make that call.
I would think, in this case, Dr. Rustin is recusing himself because he's involved in presumably the preparation of the application, so it's effectively voting on his own, but given that you're on a county level board, it's separate enough.
Better safe than sorry. And same thing goes with, there's one in there for Midway, which is in Griffin. It's the same vote I had before I voted for him before. I'll vote again, but just to acknowledge that, it is in my county directly. And I have no direct impact on them one way or the other.
I think that's fine here. You are a representative of the county. It'd be a little bit circular to have every local representative being recused when their own locality was brought up.
And Mr. Chairman, in full disclosure, I think the commission is aware, I'm currently the sitting chairman of the board at Advantage Behavioral Health Systems. And, but as anybody knows, have ever been appointed by a county commission to sit on a fiduciary board for a community service board, you're not involved in any of the work or the applications, but I'll happily recuse myself from that one item, but we'll have to take it up separately then.
Does Advantage have one
Yes.
in here? And you're a board member for Advantage?
That's correct.
I would suggest recusing yourself
Yeah.
in that case then. Which item was that?
I didn't write the number down. I don't have it in front of me.
Yes, 1440.
Okay.
1440.
And Mr. Chairman, I am owner of a MAT, a treatment center down here in Bainbridge, Georgia, that received some funding through the CareLink application from the previous year. So I'm assuming that I might be a recipient in this continued application. So I would recuse myself from the CareLink, the last one listed there, the CareLink application.
Yes, sir. Anybody else?
Well, it's a big state.
It's a big state.
No, thank y'all for upfront about those and making sure we're not crossing any lines.
Mr. Chairman.
Yes, sir.
Gary says, I have some discussion about some of the applicants
All right.
or some of the applications, if we're ready to move to that part.
Yes.
So I had mentioned it when we went over the applications with Holly, in that several of those applicants are based in the central counties around Atlanta, the ones that receive their own opioid funding and that this committee has no say over. And the concern in that these are statewide programs, but yet whether or not we're writing in the contract with them of their receipt, and Holly was going to check on it to see if it could be done, but to make sure that the funding they receive is distributed more outside of those core counties of your Fulton, Cobb, and all them that receive their own monies. That makes sense?
Melissa, answer that one.
So we, thank you, Sheriff Says. This is Melissa Malcolm. We looked into an example of one of those agencies or contractors that was based in PG County. Already have come up with a strategy on how we would look to enforce that going forward with our programmatic staff. And we are prepared to add those safeguards to the contracts from this round of funding.
How is it? What is the delineation delineator between somebody applying through the statewide route versus applying through the
So
regional?
we required that, if you are applying through statewide, that it had to cross the borders of at least 2 regions. So if it was 2 QBG counties, or if it was a QBG county in another region, but as long as the applicant was showing that they were serving people in more than one region of the state, counting QBGs as regions as they are, then that qualified as state funding.
Because no one region is deciding. on-
Exactly.
Okay.
But there was no guarantee in that funding. So if it is a county that's next to, say, Fulton, that received their own funding out of this settlement, there's no verbiage that would say, you got to make sure that you already got your own money that goes to Fulton. So really, if you service this other area, this being a statewide program, more funds should go to that other county that didn't receive their own settlement. That's the point I'm getting at.
Yes, sir. And Melissa, you said that you have a plan to address that in this
Exactly.
current funding cycle?
Yes. And a plan to incorporate verbiage into the next round of contracts.
That
Great.
Sheriff, does that answer your
I think so.
questions there? Would you like to hold any of those for further discussion?
No, I'm fine with it. I don't think there would be any ill will. It's just, I mean, just to make sure if you're putting in, I get it. There could be more need, in a more populated area. And it could easily just, we wind up serving more here, but we got to make sure those funds get out the rural areas where this assistance is non-existent at all.
Well, and I think especially since we don't have a window into the QBG counties, making sure that it's not double dipping and the QBGs aren't reimbursing for the same thing that the trust is.
Yep.
Or
Exactly.
No, and we appreciated the point, you bringing that point, so thank you.
Thank you for looking into it. Okay.
Any further discussion? All right. I guess we will start with the individuals. So the first would be item number 1250, which is DPH's application that is recommended for funding. Motion to approve. Second. All in favor?
Aye.
All opposed? Okay, that motion is approved. Next, we will do number 1440, which is Advantage Behavioral Health Systems. And I believe, David, you've recused yourself from this one. Motion to approve. Second. All in favor?
Aye.
All opposed? Okay, that motion carries. And then lastly, item 1108, which is the CareLink of Georgia. In that case, Mayor Reynolds has recused himself. So motion approved.
Motion to approve.
Second. All in favor?
Aye.
All opposed? Okay, that motion carries. And now, the remaining 43 recommendations. Is there a motion to approve?
Motion to approve, 43.
Second.
Second.
All in favor?
Aye.
All opposed? All right, that passes well. Thank you all. I think that concludes all of the recommendations.
I got a comment.
Yes, sir.
I want to say thank you to the staff for what they've done. I get to prioritize some places, small numbers of things. And it's awkward for me as I try to, okay, this one's and this one not yet. You all do that, work that out very well. And I appreciate coming in, being able to, over the last week or so, look through and say, okay, I agree and everything else, and it's all nicely done. So there's hours of work that goes into that, and I appreciate it for taking the time off of me, one. Two, I'd like to ask you all I represent all the counties, 159 of them across the state. I'd like to make sure that although we talk about some organization doing it, that all the counties, and we're not pushed up into one region or something. So what I'd like is somebody to go through and say, yep, all the counties have been accounted for, so that I can go back and feel comfortable doing that. I know that's some work, and I'm sorry, but it's a good thing overall to be able to say, no, it's just not the Atlanta region, it's not just that region. So,
Well, actually, that you bring that up, as you started to say that, I thought, oh, we should have UGA come present next time. So we have hired, we have a contract with the University of Georgia's, the David Ralston Institute for Behavioral Health and Developmental Disabilities in their College of Family and Consumer Sciences. They are conducting a monitoring and evaluation project for us. So what they're doing is they're taking all of the epidemiological data that was used and produced in the continuum of care reports and overlaying it with the applications or the funded projects and taking a look at funding. I can't even describe to you what I think would be a great opportunity for them to come present at the next meeting, but really it's making sure that we are hitting every Georgian, every county, making sure that the money is spent, that we're moving the needle, making sure that the money is spent in appropriate areas where there's problems and we're not, let's say, hitting it in an area that's not, maybe doesn't have as much of a need for one type of service and putting the money in a different place. Their work so far it's gonna blow your mind. And it will literally allow us to be able to see areas of the state where we don't have services that we need and be able to potentially target our grant making to that area in that type of category.
super,
It is.
Holly. One step ahead of me again, and I appreciate it.
That'd
That's
be
why
a
they pay me
good,
the big bucks, right?
that'd be a good meeting to hold in Athens.
That would be a good one.
I know a couple people.
Yeah. Holly, I'd like to, sometime, because I'm done, I'd like to go through again, we went through at the beginning and said, this is the kind of the prioritization way we do this, and this are the ways it's done. That's been a while ago. I'd like to, before we get into it next year, I'd like to have the opportunity, not everybody may need it, but I'd like to go through it again and say, all right, we're weighting it this way, we're weighting it this way, we're weighting it this way, so that I'm all into that. That's a heavy responsibility. Trust you all to do it, but I'd like to think about it one more time.
Absolutely,
Yeah.
absolutely.
Okay.
We can absolutely do something.
And it could be one of the quarterly meetings just to go over it again, or, okay, Clay, you're so slow. I'm gonna do this after the meeting so that you get it. That's okay with me too. I don't have a problem with that. Okay.
Absolutely.
But once again, thank you to you all for what you're doing, with this. Yeah. I don't know how it is with the rest of the reps, but an opportunity to get out what we have just approved is pretty important to us. I know it goes to the trust and all that stuff, but if we can do something fairly quickly to us so that we have some information, to say, all right, here's where we are. What you all do at the hires, okay, but here's where we are now. I would appreciate that, some kind of, whether that's press release or just information for us or something at this level, this is how it came out for us. And I've seen we have all the charts, all the data.
Yeah.
It's just a matter of, doing some pretty work to get it ready to go for us.
I think a press release is going out. Pretty sure,
Okay,
99% sure.
okay, all right.
And I'll say a big amen to Clay's comment on my behalf, because representing the Community Service Board Association, it's any help y'all can give me along the lines, making reports, how we can shore up applications and that sort of thing.
I have a note to talk to David, but it'll include you also. Let me just say it up front so everybody understands. David holds a conference that we just finished with at Lake Lanier, and the 22 CSPs all come and they go through and they do all of that stuff. I'm going to recommend to David that we have a session for all the CSPs that are trying to write to say, hey, at 2 to 3:30, this is the time that GOSAC's going to come in and talk about how to write it, do that to be able to do it. At one time, you can knock out 22, which covers the entire state. So it'll be a good opportunity for some that don't have grant writers, or that this is, for some like Emory that may have 4 or 5 grant writers, easy for them. For a CSB that's just barely hanging on, trying to hold together what they've got, opportunity to do that. So I'll recommend it to you, and then you can talk to them about it.
I will, yeah. And we just held that last week, so you've got a year to draw straws as to who that will be.
Okay, excuse me. I think that's all I've got, Chairman.
Thank you.
May
One,
I?
I will also say thank you very much for the work that y'all do. It's immense and immensely helpful, and very much appreciate it.
It is an honor and a privilege to be able to do this kind of work. May I take a point of personal privilege?
Sure.
I'd like to introduce Jeff Holliday, who I neglected to introduce at the beginning of this meeting. Jeff is our newest staff member as we are growing. So I just want, he's only been with us for 2 weeks, but he's already been a huge help. So
Welcome aboard.
Well, I be here.
Okay, this is the opportunity to make a motion to adjourn.
We have a public comment period.
Yeah, okay, excuse me, yes.
You ready to go, man? Huh? You ready to go, man? But the people are just going.
yeah, so these are all just online. If you want to speak, then this is the one person who wants to speak.
Okay. All right. All right, well, we will move into our public comment period. As a reminder, for public comment, please limit your comments to 3 minutes so that everyone who signed up has a chance to speak. And we'll start with our Mr. Winston Carty.
Yes. Hello, thank you. I'm honored to be in front of this esteemed body. I am just humbled and honored by the work you do. My name is Dr. Winston Carty. I am now the current president of the Georgia Chiropractic Association, which is brought into that position as of Friday last week. And I had an opportunity to come before the committee about non-pharmacological uses of opioid. And we presented, and we have some very good stats. All this data said that if you start a treatment with chiropractic, the usage of opioids and medication reduces drastically, and the patient satisfaction rises. So it led me to start seeing how we could introduce it. And then I was at the convention, and Dr. Holstenbeck is part of a group in Brazelton, Georgia, and he runs a very successful treatment clinic that has chiropractic at the center, and they're doing very well with the grant. And then I said, you know what? I want to push this as a possible solution. And I found out you guys were meeting, and I showed up, and boys, everybody's here. So I'm very, very excited. And I learned now where I could possibly go to apply, maybe at the regional level. So I want more information. And I'm just proud to be here, and hopefully we can be part of the solution. And sir, the 59 counties, I'd love to have all my chiropractors be represented and do something to help.
Karen Bapiak is my representative, who is a chiropractor.
Wonderful, and a board member.
And talk to her.
Yes.
Get her moving along. It's another way to get what we want done in the General Assembly.
Okay.
So she's, I'll talk to her. I get to talk to her every week or so. So we'll push her to make sure she raises her hand at the right time.
We're on the same thing. Thank you, sir.
If you are looking for more information, gaopioidtrust.org is our website, and we just launched a brand new website, and it's got a ton of information. You can find out all about the last 2 rounds of funding, which will provide you information for the next round of funding that'll open up this spring.
Amen. Thank you for being here. I look forward to it. Oh, thank you.
Thank you. Thank you. All right, you're gonna, Mr. John Etherington, Alliance Recovery Center.
He's online.
And I just unmuted you, John.
Oh, I'm sorry. I don't have a public comment.
Oh, you don't? Okay, thank you.
Okay. Paula Mullins from Mounts, excuse me, I apologize. Paula Mounts from Divergent Recovery Center is also online.
She left.
Oh, okay.
Okay. Joe Carter from Emory also online.
Okay.
Do we have a David Newton from Georgia Primary Care Association online?
Okay.
Okay, well, that concludes our public comment period then. I think at that point, there's only one motion.
Motion to adjourn?
Second. All in favor?
Aye.
Aye.
Anyone opposed?
Well done, Chairman. Well done.
Thank y'all very much for adjourn.
Yes, I know.
Yeah.